The previous structures of the eye and ocular annexes will be evaluated by a special direct technique called diffuse illumination. First of all, you have to do the respective cleaning of the slit lamp. We are talking exactly about the chin rest and forehead rest. Then you have to adjust the eyepiece taking into account the possible visual defects on the person who is checking the patient. Also, you have to confirm if the click off is centered. We take an angle between 40 or 50 degrees. The slit has to be completely open and it must be a low brightness light. We use a minimal magnified view. The patient has to be properly seated on the chair, with the forehead on the forehead rest and the chin on the chin rest. The light must be temporarily projected to the evaluate eye. We slightly zoom in the slit lamp to the eye, in a way that the light shines directly, and we must clear the examined structures. Remember to ask the patient to close his eye, so we can begin to check the ocular annexes. The first one is the eyebrows. We can change from temporal to nasal, checking if it exceeds the pigmentation or foreign bodies. Upper and lower eyelids. You have to check them from the external to the internal third. Check if there is redness with elevations, pigmentations, presence of scabs or secretions. Of course, we check the eyelid edges and glands too. Eyelashes. It must be checked then from the external to the internal third. Look carefully if exists foreign bodies, the pigmentation or any kind of decrease of the totally eyelashes. Conjunctiva. First, check the bulbar conjunctiva. Check it is transparent without any elevations, and the last thing you need to take care of is to observe the course and caliber of blood vessels after all those previous steps. After that, we check the tarsal conjunctiva without elevations and with a normal pink color. Finally, we check the course and caliber of blood vessels, like in the previous step. We have to check the high conjunctiva as well as the low conjunctiva by the eyelid eversion. Cornea. We check the clarity and if there are blood vessels. Iris. We check its color, shape and wholeness. Pupil. We check the shape and if exists just one pupil. Then proof if it revives when we put it to the light.